In this video, I'm about to show you how the federal government just exposed one of the largest hospice fraud rings in American history. These weren't small-time operators. This was a sophisticated network of doctors, nurses, and marketing executives who figured out how to drain millions from Medicare by enrolling patients who weren't dying. Patients who had no idea they were even in hospice. Patients who were still working full-time jobs. This isn't a mistake. This is organized theft from every single American taxpayer. Let's get into it. The Department of Justice announced in April 2024 that a massive hospice fraud ring operating across 3 states has been dismantled. The ring, centered in Southern California with satellite operations in Nevada and Arizona, bilked Medicare out of an estimated $42 million over just 4 years. Here's how it worked. The ring operated through a network of shell companies, fake hospices with real Medicare provider numbers. The main entity was called Angels of Mercy Hospice, Inc., with locations in Los Angeles, San Diego, Las Vegas, and Phoenix. According to the unsealed indictment, Angels of Mercy enrolled over 2,000 patients who did not meet hospice eligibility requirements. Some of these patients had minor conditions like high blood pressure, some had arthritis, some had no documented medical conditions at all, but they were all billed to Medicare as if they were terminally ill. The DOJ has charged 11 people so far. The mastermind was Dr. Alan Berkman, a 62-year-old physician from Beverly Hills. The operations director was Michelle Torres, a registered nurse. The marketing director was Kevin Williams. And there were 8 other co-conspirators, including billers, recruiters, and a pharmacist. They all face charges of healthcare fraud, conspiracy to commit wire fraud, money laundering, and kickback violations. Combined, they could face over 100 years in federal prison. But that's not going to bring back the $42 million they stole. That money is gone, spent on luxury cars, vacations, and beachfront property. Let me walk you through exactly how this fraud ring operated, because it's a playbook that other corrupt providers are probably using right now. Medicare pays hospices a daily rate, currently about $213 per patient per day for routine home care. That's over $77,000 per patient per year. To qualify for hospice, a patient must be certified by 2 physicians as having a prognosis of 6 months or less if the disease runs its natural course. The patient must also waive standard Medicare benefits and agree to palliative care only. Angels of Mercy ignored all of that. Here's what they did instead. First, they used marketing recruiters, Kevin Williams and his team, to find elderly patients. They targeted senior centers, low-income housing complexes, and even church groups. They told seniors that hospice was free extra care and that it would help with their regular medical needs. They never mentioned that enrolling in hospice means waiving standard Medicare benefits. One victim, Ethel Morrison, an 81-year-old woman from San Diego, told investigators that the hospice representative said it was just a program to check on her at home. She didn't realize she had been enrolled in hospice until she tried to see her cardiologist and was told her Medicare was no longer covering treatment for her heart condition. Second, once patients were recruited, Dr. Berkman falsified their medical records. He created fake terminal diagnoses, lung cancer, heart failure, advanced dementia, for patients who had none of these conditions. He backdated certifications. He forged the signatures of other physicians who had never met the patients, and he billed Medicare for each patient as if they were receiving daily nursing care. But here's the kicker. Most of these patients never received a single hospice visit. Michelle Torres, the operations director, assigned each patient a nurse on paper, but no nurse ever showed up. The nursing notes were all identical, copy and paste, written by Torres herself. She would write, "Patient resting comfortably, no complaints, vitals stable," for patients she had never met. Third, the ring used a network of corrupt pharmacists to bill for expensive medications. Hospice patients are entitled to medications related to their terminal diagnosis. So the ring billed Medicare for thousands of dollars worth of painkillers, anti-nausea drugs, and other medications, many of which were never dispensed. The drugs that were dispensed often went to patients who didn't need them or, in some cases, were resold on the black market. The indictment includes evidence that Angels of Mercy billed Medicare for over $3 million in medications over 4 years. An audit found that less than 10% of those medications were actually provided to patients. The rest were either never ordered or were ordered and then diverted. Dr. Alan Berkman wasn't some shady physician working out of a strip mall. He was a respected doctor with a private practice in Beverly Hills. He had admitting privileges at 2 hospitals. He was board certified in internal medicine, and he used all of that credibility to defraud Medicare of over $40 million. According to the indictment, Berkman signed over 3,500 hospice certifications between 2020 and 2023. That's nearly 3 per day, every single day, including weekends and holidays. There is no physical way he personally examined all those patients. There's no way he reviewed their medical records. He was selling his signature for $500 per certification. The DOJ has emails showing that Berkman's office manager warned him in 2021 that he was signing too many certifications. The manager wrote, "Dr. Berkman, we need to slow down. This volume is going to attract attention," Berkman replied. "Don't worry about it. Medicare doesn't audit hospices. They don't have the staff." He was wrong. The FBI was already watching. Berkman used the money to fund a lavish lifestyle. He bought a $3 million home in Malibu. He drove a Porsche. He took trips to Europe, the Caribbean, and Asia. He spent over $200,000 on a single birthday party for his wife at a hotel in Santa Monica. When the FBI raided his home in February 2024, they found over $500,000 in cash in a safe in his closet. They found jewelry valued at over $1 million. They found documentation of wire transfers to offshore bank accounts in the Cayman Islands. Berkman was arrested at Los Angeles International Airport trying to board a flight to Switzerland. He had a one-way ticket and a bag packed with clothes. He was fleeing. The FBI stopped him at the gate. He's currently being held without bail. The judge called him a flight risk and a danger to the community. His medical license has been suspended. He's facing up to 60 years in federal prison. Michelle Torres, the operations director at Angels of Mercy, was a registered nurse with over 20 years of experience. She had worked in legitimate hospices before. She knew the rules. She knew what qualified as a terminal diagnosis. And she approved the care plans for over 2,000 fake patients. According to the indictment, Torres personally reviewed patient files and knew that many didn't meet hospice criteria. She saw the missing diagnoses, she saw the forged signatures, she saw the fake care plans, she saw that no nurses were actually visiting patients, and she approved it all anyway. Why? Money. Her salary was $250,000 per year, nearly triple what a hospice clinical director typically makes. She also received quarterly bonuses based on patient census. More fake patients meant more bonuses. In 2022 alone, Torres received over $100,000 in bonuses. The indictment includes a text message that Torres sent to a friend in 2022. She wrote, "I know it's not right, but the money is too good. I can't walk away from $250K. No one's getting hurt. They're old anyway." No one's getting hurt. That's what she wrote. But people were getting hurt. Real hospice patients, people with actual terminal illnesses, were being turned away because Angels of Mercy had filled their slots with fake patients. One legitimate hospice in San Diego told investigators that they had to put 12 patients on a waiting list in 2022 because Angels of Mercy had blocked their referrals through a kickback scheme with local hospitals. Torres was arrested at her home in Las Vegas. She's charged with healthcare fraud and conspiracy. She could face up to 30 years. Her nursing license has been suspended. She's out on bail, $500,000, and is confined to her home with GPS monitoring. Kevin Williams was the marketing director. His job was to find patients, and he was good at it. Between 2020 and 2023, Williams recruited over 1,500 patients for Angels of Mercy. He was paid a base salary of $150,000 plus a commission of $1,000 per patient. Williams targeted the most vulnerable seniors. He went to senior centers and told residents that hospice was free government care. He went to low-income housing complexes and promised seniors that they would never have to pay for medical care again. He even went to church groups and told elderly parishioners that God wants you to accept help. One victim, Harold Jenkins, a 79-year-old veteran from Las Vegas, told investigators that Williams came to his apartment 3 times, each time bringing gifts, cookies, a blanket, a $20 gift card. Williams told Jenkins that he had already been approved for hospice and just needed to sign a few papers. Jenkins signed. He had no idea he was waiving his standard Medicare benefits. He had no idea he was being listed as having terminal lung cancer. Another victim, Doris Washington, an 82-year-old widow from Phoenix, was recruited at her church. Williams told her that hospice would help her with housekeeping and meals. She signed up because she needed help around the house. She never received any help. Instead, Angels of Mercy billed Medicare for her for 18 months, over $100,000. Williams was arrested at his home in Las Vegas. He's charged with conspiracy to commit healthcare fraud and violations of the anti-kickback statute. He's facing up to 20 years. He's out on bail, $250,000, and is not allowed to have any contact with seniors or patients. The DOJ has traced over $35 million of the $42 million stolen by Angels of Mercy. Here's where it went. Dr. Berkman personally received over $12 million. He used it to buy the Malibu home, the Porsche, the jewelry, and the trips. He also transferred over $2 million to accounts in the Cayman Islands and Switzerland. The DOJ has frozen those accounts, but recovering the money will take years of litigation. Michelle Torres received over $3 million in salary and bonuses. She used it to buy a vacation home in Cabo San Lucas, Mexico. She also bought a boat and a luxury SUV. The DOJ has seized the vacation home and the boat. Kevin Williams received over $2 million in salary and commissions. He used it to buy a house in Las Vegas and to fund a gambling habit. He lost over $500,000 at casinos in Nevada over 4 years. The remaining money went to the other 8 co-conspirators, to operating expenses, and to kickbacks for hospital employees who referred patients. The indictment includes evidence that Angels of Mercy paid over $1 million in kickbacks to employees of 3 hospitals in Southern California. Those employees would identify patients being discharged and refer them to Angels of Mercy, often without the patient's knowledge. The kickbacks were disguised as marketing fees and consulting payments. The DOJ is still investigating those hospital employees. Charges are expected in the coming months. Angels of Mercy isn't the only hospice fraud case the feds have busted recently. Let me tell you about 3 others that should make your blood boil. Case 1, Texas. In 2022, a hospice called Novus Health Services in Houston paid over $13 million to settle hospice fraud allegations. They were billing for patients who weren't homebound. One patient was actually attending college full-time while listed as receiving hospice care. The owner, Marcus Webb, used the money to buy a Ferrari, a yacht, and a vacation home in Florida. He's currently serving 12 years in federal prison. Case 2, Georgia. In 2021, Asana Hospice in Atlanta was shut down by the FBI. They had enrolled over 300 patients who didn't qualify. The owner, Dr. Michael Chen, signed certifications for patients he had never met. He admitted to federal investigators that he sometimes signed stacks of blank forms. He got $30,000 per month. He's serving 36 months in federal prison. Case 3, Illinois. In 2020, American Hospice Management in Chicago paid $15 million to settle claims that they had billed for services never provided. Their marketing director had been paying kickbacks to nursing homes to refer patients, $500 per patient. That's illegal. Medicare explicitly prohibits patient brokering. The marketing director, Patricia Gomez, is serving 18 months in federal prison. These cases have something in common: corrupt medical professionals who put profit over patients, doctors who took an oath and broke it, nurses who knew and did nothing, executives who got rich while real patients, dying patients, were turned away. The investigation into Angels of Mercy started with a whistleblower. A former employee named Sarah Miller, a billing specialist who worked for Angels of Mercy for 8 months, became suspicious when she noticed that the same patients were being billed for years. Hospice is for 6 months. These patients had been in the system for 2, 3, 4 years. Miller reported her concerns to the HHS Office of Inspector General in February 2022. She provided copies of patient files, billing records, and emails. The OIG opened an investigation. Within 6 months, they had referred the case to the FBI. The FBI spent the next 18 months building the case. They interviewed over 100 witnesses. They subpoenaed bank records, phone records, and email servers. They executed search warrants at the Angels of Mercy offices in Los Angeles, San Diego, Las Vegas, and Phoenix. They found boxes of patient files, over 2,000 of them, most of which contained forged signatures and fake diagnoses. They also found evidence that the ring was trying to cover its tracks. In 2023, after learning that the OIG was asking questions, Michelle Torres ordered her staff to shred patient files and delete emails. The FBI recovered shredded documents from a dumpster behind the Angels of Mercy office in Las Vegas. They also recovered deleted emails from the company's backup servers. That evidence is now part of the criminal case. Torres faces an additional charge of obstruction of justice. Let me tell you something else about this investigation that doesn't get talked about enough. The FBI agents who worked this case spent over 2 years tracking down patients, interviewing families, and piecing together the paper trail. They visited over 600 patients in person. 600. Many of them were elderly, confused, and had no idea why federal agents were knocking on their door. One agent told a reporter that she had to explain to a 90-year-old woman that she wasn't dying of cancer, that she had been listed as terminal for 3 years by a doctor who had never even examined her. The woman cried. She had spent 3 years thinking she was dying. 3 years of anxiety, of saying goodbye to family, of living in fear, all because Dr. Berkman wanted a bigger bonus. That's the human cost of fraud. It's not just money, it's years of a person's life stolen. Years they could have spent enjoying retirement, traveling, being with family. Instead, they spent them terrified that any day could be their last. And Berkman? He was flying to Switzerland. That tells you everything you need to know about who these people are. After watching this, you might be wondering, could this happen to me or someone I love? The answer is yes. Hospice fraud targets the elderly, especially those with cognitive decline, those who live alone, and those who trust anyone in a white coat. Here's what you need to know. Hospice is for people with a terminal diagnosis, 6 months or less to live. If a hospice contacts you out of the blue, be suspicious. Legitimate hospices get referrals from doctors, not cold calls. Ask questions. What is my diagnosis? Which doctor certified me? Why do I qualify for hospice? If you don't have a terminal illness, you don't belong in hospice. Check your Medicare summary. Notice Medicare sends these every 3 months. Look for hospice claims. If you see hospice charges for someone who isn't in hospice, report it immediately. The number to call is the HHS OIG hotline, 1-800-HHS-TIPS or 1-800-447-8477. You can also report online at oig.hhs.gov. You can report anonymously, and if you report fraud that leads to recovery, you might be eligible for a whistleblower reward up to 30% of what the government recovers. In the Angels of Mercy case, the whistleblower, Sarah Miller, is eligible for a reward of up to $12 million. That's 30% of the $42 million stolen. Not bad for doing the right thing. If you have a loved one in hospice, visit them. Ask to see their care plan. Ask to meet their nurse. If something seems wrong, if you never see a nurse, if the patient doesn't have a terminal diagnosis, if the paperwork doesn't match reality, speak up. This case isn't just about $42 million. It's about what that money represents. Every dollar stolen from Medicare is a dollar that isn't available for legitimate patient care. And let me tell you, the need is real. The National Hospice and Palliative Care Organization estimates that over 1.5 million Americans receive hospice care each year. That's 1.5 million people with terminal illnesses, people who are dying, who need comfort care, who deserve to spend their final days in peace. When fraudsters like Dr. Berkman and Michelle Torres steal from Medicare, they're not stealing from the government, they're stealing from those 1.5 million people. They're stealing from the grandmother with cancer, the grandfather with heart failure, the child with a terminal genetic disorder. The DOJ is cracking down. In 2023 alone, they announced charges against over 70 medical professionals in 20 different fraud schemes. Total fraudulent billing, over $2 billion. But for every case that gets caught, how many are still operating? The DOJ estimates that healthcare fraud costs taxpayers between $60 and $100 billion per year. That's billion with a B. That's your money. That's my money. And it's being stolen by people who think they won't get caught. Dr. Berkman thought he wouldn't get caught. He was wrong. He's sitting in a cell right now, waiting for his trial. Torres thought she could shred her way out of trouble. She was wrong. She's under house arrest, facing 30 years. The feds are watching, the whistleblowers are coming forward, and the fraudsters are going to prison. But they can't do it alone. They need you to pay attention. Read your Medicare statements, ask questions, report suspicious activity. We have to protect the Medicare system. Not because it's perfect, it's not. But because millions of Americans rely on it for their health care, Every dollar stolen is a dollar taken from a grandmother who needs chemotherapy, a grandfather who needs surgery, a family who can't afford private insurance. The people running Angels of Mercy didn't think about any of that. They thought about themselves. They thought about their bonuses, their boats, their vacation homes. And now they're facing federal prison.